Morning. Today is Monday, October 5th, 2015, and we're going to interview Alicia today and get her perspective on Terry Yochum, her father. So Alicia, could you start off, tell us your full name and when and where were you born?
My name is Alicia Marie Yochum. I was born September 5th, 1984 at Aurora Medical Center in Denver, Colorado, in Aurora, Colorado.
Okay. Now your family has a tradition about names. Can you explain what your name is?
My name, our tradition is that our initials actually spell something. So having the last name that starts with Y makes it convenient because there's a lot of words that, three-letter words that end in Y. So my name spells Amy, A-M-Y. And my brother's is Pay, and my sister's is K, and my dad's is Try. So my mom doesn't have a middle name, so she's not in there, but the rest of us all, our initials spell something.
Can you tell us about things you remember from your early childhood in the Yochum family?
The things I remember dancing a lot. That's a little bit older, my childhood, but the dancing I remember a lot. I started when I was 2, but the swing dancing I did, we started when I was 8. So I did a lot of jazz, tap, and ballet and went to a lot of competitions and that type of stuff. And that's kind of the main memories that I have of childhood.
Tell us a little bit about your early school life.
My early school life. I went to Rocky Mountain Elementary School, which was right up the street. My neighbor is around my age, so we went to school together. And I had a good elementary school. It was fun. I don't really have any specific memories of it. I was in art. I guess I do remember doing some stuff in art and doing a sculpture of a emu, which is emu, which is it's like an ostrich from Australia. So I do remember doing that in elementary school, which was like a huge thing. It was big.
You mentioned the swing dancing. Could you tell us how you got into that and what your experiences in that community was like?
Yeah. My dad did swing dancing when he was young and when he was in high school with my aunt, with his sister, and he kind of got us into it a little bit. And then we'd already been doing the jazz, tap, ballet, all of those that dancing, so it was kind of an easy transition into doing swing dancing. So we started taking lessons and started putting together routines, and there was a swing club in Denver that we would go to every Sunday. So we kind of got into the community, and it was really fun. And then it continued on through I think we quit when we were like 16. And it was great. It's a very welcoming community, and we traveled all over competing, and you get to know people from all over the nation, and it was a really great time. And then we got to go on family trips a lot with that, so it was really fun to be able to go places as a family and see all the people that we'd met all over the country. So it was great.
You are fairly successful, I understand.
As a swing dancer?
Yeah.
Yeah, we were.
Explain that.
Yeah, so every year there's a competition in California called the US Open, and it's like nationals of swing dancing. You do little competitions all over the country. Each city kind of has, the cities that have a lot of swing dancers will have a little competition in preparation for the US Open. And so you practice your routine at all the little ones, and then you go to the US Open. And my brother and I won the US Open when we were, I was 9, I think, somewhere around there, 9, and he was 12. So I would have been like 10 or 11. And we won the nationals that year. So I think we win a total of 5 years, but that was our best year, and we placed first. So
congratulations.
Oh, thank you.
I've seen the video of your dance. It's very good.
Yeah.
So in addition to swing dancing and all the time and activity that took, what was family life like in the Yochum household?
I will say that some of my memories from when I was very young are, I don't have a lot of memories. I just remember us having fun and Easter egg hunts and just the normal kind of activities of Christmas. And my mom always did fun things with Santa. And I remember one year we had a fireplace. And it wasn't like the high-tech fireplaces now that
Right.
have the glass over it. It was like a real fireplace. And she made it to look like Santa had come stepping out of the fireplace. But
Oh,
she
my.
did it with flour. And it was when we were really young. So I didn't even realize, like, if that was actually snow. I guess it could have been the ash of the fireplace, but I thought it was snow at the time. It would have melted. So, I mean,
yes.
it was, I mean, I just remember a fun childhood and some activities. We didn't go on a lot of vacations, but the dance trips were kind of the vacations that we took. So it was good riding around in the Corvette. And
Oh, good. Do you have memories of your grandparents?
My dad's dad, I don't really have a lot of memories of because he died when I was so young. The memories that I do have are of him in the nursing home. So I don't really remember him. I remember the nursing home. So
That would make sense, yes.
yeah, I remember the way it looked and the plants.
How about your grandmother?
Weird. I do remember her quite a bit because she lived quite a long time, and she was just a wonderful person and so warm and caring, and I always loved visiting her. I remember her hands distinctly and her smell. She had a very warm, welcoming smell, and she was just very wonderful.
Nice lady. What's your earliest memory of your dad?
My earliest memory, like I said, I don't have a lot from like when I was really young. I would say my earliest memory is probably riding around in the Corvette. There was a specific time where we went on a 4th of July parade in our neighborhood area. And the Corvette's a 2-seater
Yes.
car, as I'm sure you know. And when I was little, I was obviously the youngest and the smallest. So I used to, when you put the top up on the car, it opens up an area in the back of the car. So I used to get into the back, like underneath the car, the back of the car, and I would hang out back there. So I remember doing that a lot when I was young. But the parade that we went on, I sat up on the back of the top because the top was down, and we waved flags, and I think we've got some pictures of that somewhere. But
Oh, good.
I think I was probably around 3 or 4, so I think that's my first memory of my dad is riding around in the Corvette like that.
Well, I know that you received a lot of family encouragement in the swing dancing community, but how did your dad support you and encourage you as you grew older in your life? What sort of things did he do?
I mean, he really just supported me in whatever I wanted to do. I knew I kind of wanted to go into healthcare, but I didn't want to go to school forever. So he didn't push me to go into anything in particular. I chose nursing, and he completely supported me with that. So I just always knew that I could do whatever I wanted to, and they would always be there.
Well, good. Now, we know you have a brother and a sister. What were they like, and how did you get along with them?
My brother I danced with, so we had I guess you would call it a typical brother-sister relationship. Growing up, we definitely had some friction. We fought like any other brother and sister would, but we were around each other a lot more with dancing because practicing 20 hours a week puts you together a lot. So I do think we got really close through that amidst the normal brother and sister bickering and fighting over who's going to do chores or whatever. So I think that my brother and I have a closer relationship now because of all the dancing that we did before.
I would think.
My sister, I would say that I don't really remember. She got sick kind of before I can remember anything. So all of my memories of her are of her being sick, sadly.
how has her illness affected you in your life?
I would say that, I was very young when she first got sick. And through my childhood, I don't really remember a lot of effect on my childhood. I knew she was sick, but it didn't really register for me the way that you would think it would. I still remember having a happy childhood and having all of the things that I would want in a childhood. I just knew that she was sick. I would say that it affected me a little bit more when I got older into high school because I helped take care of her. So that put a lot of stress on my relationship with her. So, but when I was young, I knew something was wrong. I just didn't
understand the nature of it.
And I don't think it really affected my happiness as a child. So.
Well, that's a good thing.
Yeah.
How do you think Kimberly's illness has affected your parents, especially your dad?
I would definitely say that it had a larger effect on my parents, obviously, because they were caretakers. Specifically, my dad, he struggled with not being able to help her and figure out what was going on at the beginning.
Well, I know your dad is a take charge guy and wants to fix everything and everybody, and
Yeah.
so I can understand where that would be probably more than anything else very frustrating to him.
And the fact that there's no treatment for what she has is very frustrating because there's literally nothing we can do other than the chiropractic treatment that she received, which really saved her life, actually. For my mom, it was especially hard because she was the primary caretaker, so the day-to-day stuff, she was the one that was doing. My dad was still able to travel and lecture, but my mom was at home all the time. So when my sister was growing up and into high school and before she went and lived at the apartment complex and the assisted living place that she's at, it was really hard on my mom having to do the large majority of the caretaking. So they kind of have had a different experience with the struggle with what Kimberly has, but they both struggled with it.
Yeah, I can understand that. Growing up in the Yochum household, I know there were family values and expectations. What values do you think were passed on to you and have molded your life?
I would say that the values that have been instilled in me are things like honesty. I'm very, very honest person. I have a very hard time lying to anyone, and that's definitely coming from my parents. And loyalty. I'm very loyal, just like my dad. My dad is a very, very loyal person, and I really value friendships and instill a lot into my friendships, and in turn expect a lot from my friends. And that's a quality that I know that I get from my dad because
Very much.
we are very, very similar in the way that we, conduct our friendships. So I know that I get that from them. And just being respectful of others and respectful of elders, seeing the way other people interact. I know that my parents instilled that in me because I'm very respectful of just other people in general, especially my superiors.
How does it feel to be following your dad in radiology now?
The golden question. It's great, honestly. I mean, I think a lot of people would think that I'm intimidated by the fact that he's so successful and that I want to do something else so that I'm not following in his footsteps, but I don't feel like that at all. I feel like he has done so much and he's worked so hard in his life. I don't know why I wouldn't take advantage of that opportunity and what he's worked for so hard. It's not like I haven't worked hard for where I'm at. I mean, I had to do all the work on my own to get to become a radiologist, but I think it's great that we're able to be in the same profession and have conversations about patients, and he can teach me, and it's just been wonderful. I haven't had any problems with it.
Good. What do you think it would be like to work in his practice with him?
Well, that will be happening pretty soon here. My dad is a very hard worker. You have to be if you're going to write a book like he did. So he also really likes to keep busy, and it'll be interesting to see how he does when he doesn't have every day all of these things to do. He'll still do lectures with me and stuff, but eventually he'll kind of phase out of practice. So I'll have to keep him busy doing other things.
Yes, he and I have already had a brief moment of that discussion.
Oh, really?
Yeah, he doesn't have the answers.
No, he doesn't. So, I mean, I'm excited for it. I think it'll be okay. I've kind of formed a relationship with my dad to where I'm one of the few people that can kind of put him in his place. Which, if any of you know my dad or have seen him, yeah, he is not the type of person that you can just say, like, no, you need to stop that. And I'm one of them. I mean, my mom's one of them. You're one of them. But there's only a handful of people. And it took a long time to get there as an adult and be able to do that with him. I'm still not disrespectful. But I can say, like, no, Dad, you shouldn't be doing that or whatever. So,
well, that's good.
It's definitely good when I'll be coming into practice with him. So
You mentioned the lecture circuit. Tell us about your beginning in that area and how do you see that proceeding?
Yeah, I do a lot of lectures with my dad right now. I think that we've been lecturing together for a little over 2 years. The first one we did was in Albany, and I was super, super nervous and
Understandable.
stood in one place the entire time. So, but since then, it's been great. I mean, we've traveled all over the country. We were just in Europe. We gave some lectures over there. It's really nice to be able to play off of each other, and he'll answer a question and I'll have something to say, so I'll pipe up or I'll ask his opinion on something. And it's really nice to be able to have him there as a more experienced person to answer questions that I'm not comfortable with. So I think it's gone wonderful. We don't really have any problems. And being in residency, it's given me an opportunity to be able to see him on a pretty regular basis, traveling and doing lectures.
Good.
So it's
I
been
understand your teaching prospects have taken off in a new direction here recently with the webinars.
Yeah, we just started doing webinars. We've done 2 now. So I kind of do most of the prep work for that, since my dad isn't really the most tech savvy person. That's putting it mildly. So I organize all that, and we just sit there and I do everything and he talks and I talk. So it's gone really well.
Good.
Yeah.
So where do you see your life moving forward?
Well, I am in my fellowship right now. I just started that, and it's in diagnostic ultrasound, which is kind of the up-and-coming imaging of musculoskeletal imaging. So when I get done with that, in 6 or 7 months, I will come back to Colorado, and that'll be next summer sometime. And I'll take over my dad's practice. Eventually, we'll kind of phase in, and I'll have a specific diagnostic ultrasound practice, because there's not a lot of people in Colorado or Denver that are doing that technology. So I'm expecting to have quite a large diagnostic ultrasound practice as well. And I want to treat patients.
Good.
So I'm just going to do everything.
Tell us about the big test you just took.
Well, I did just take boards and passed, yay. So I studied for 3 years in my residency, all in preparation for boards.
Explain what they are and what does it mean.
Oh boy, it's 2 parts of boards, and the first is written, and it's a bunch of multiple choice questions on all the different sections. So I'm a musculoskeletal radiologist, but I still have to know everything about chest and the brain and spinal cord. Obviously, as a chiropractor, we do a lot of spine imaging, and abdomen and all of the GI tract and genitourinary, everything.
I understand that you were somewhat of a rarity completing this test.
What do you mean?
Well, I don't think most people do it on the first try.
Yeah, it's a rough test. The first part of the test with the multiple choice is a little bit easier and has a higher pass rate. The second part of the test is a oral practical portion where you read 30 cases at 6 different stations, or 5 different stations, and you have 6 cases at each station, and you have to do all 6 of them in 30 minutes. So the time constraint on it is the most stressful thing I've probably ever done. It's very stressful.
You have to know what you're looking at quickly.
And I would say that the pass rate is usually around 50 to 60%. So 40 to 50 fail. Yeah, thank you.
Tell us about the alphabet you got behind your name now.
Yeah, so I'm trying to get as many letters as my dad. I'm working on it. I was a nurse beforehand, so I have an RN degree behind my name. And then I got my DC, so Doctor of Chiropractic is behind there. And now I have DACBR, which is the Diplomat of the American Chiropractic Board of Radiology. So that's my radiology degree. So.
Is there some more letters to come with the diagnostic imaging?
There is. At the end of the diagnostic ultrasound, we take a test, and it's the RMSK, so I'll maybe have those letters behind my name. And then I've kind of played around with the idea of going to nurse practitioner school, so I just want to be in school forever.
Oh,
so we'll see if I eventually get a NP behind my name, too.
Oh, my goodness.
Then I might come close to my dad's letters.
Keep going.
Yeah.
Well, to kind of sum up a little bit, tell us what your feelings are about your overall relationship with your dad.
I have a great relationship with my dad. I've always had a great relationship with my dad we had the bond through swing dancing at first, and then I went to nursing school and we had kind of a medical bond, and now through the chiropractic and radiology we even have that. So we're very close. I talk to my parents literally every day on the phone. So I'm 50% my dad and 50% my mom. So I'm very close with both of them. But I'm very close with my dad, and we have a great relationship, and we're very honest with each other, and I have no problems with my dad.
Good.
He's never pushed me into anything. A lot of people, especially in chiropractic, think that he pushed me into radiology and he pushed me into chiropractic, but if that was the case, I never would have gone to nursing school, because the 4 years that I spent there, I mean, I'm very grateful that I'm a nurse. I think that it's helped me have a well-rounded education and approach a patient in a very well-rounded manner. So I'm grateful that I did it, but if he would have pushed me into anything, I would have never done that, because it was 4 years of my life, and now I'm just finishing all of my imaging. I could have done this 4 years ago. So he's never pushed me into anything, and he never pushed me into radiology either. I chose to do radiology. I had a knack for it. I have an eye for it. I liked it. So it was my choice to do it, and he never really pushed me into it, which is something that, my dad has a strong personality, and a lot of people think that he pushed me into it, and he had nothing to do with that decision. I mean, he obviously, through my whole life, he supported me in whatever I wanted to do. So he supported me in it and was excited that I chose to do it.
Very good.
It was not his decision, it was mine.
Okay. Well, I have no more real questions for you, but I want to give you an opportunity to add anything you think that I might have failed to cover, or anything you want to bring up or say.
I would say that some people might think, oh, this book, he's just writing it to kind of be boastful and so that people know how great he is. And that's not at all why he's writing this book. This book about his life is really to show people the work of labor and the labor that it took for him to give the essentials of skeletal radiology to the profession, which was such a huge thing, especially in the time that it was done, because there were no medical publishing houses that were willing to publish anything by a chiropractor, because we were considered the leper colony at that time. I mean, my grandpa was put into jail because of him treating patients without a license and giving vitamins without a license. So that was a long time ago, but this book was published in the 80s, so that it was still a period of time where they didn't look kindly upon upon chiropractors. So for them to publish this book was huge, so he had to make sure that it was perfect. And publishers, people don't realize, they're not really necessarily there to help you every step of the way.
Exactly.
I mean, they are, but they're more concerned about getting it done. They don't necessarily care that the arrow's in the wrong place. But as a radiologist, if that book is being used by students and the arrow's not pointing at the right thing,
Exactly.
that doesn't make any sense as a radiologist specifically. I mean, so you can't point at one thing and then have the caption. It doesn't make any sense. So
Exactly.
there was, as you'll read in the book, lots of arrows that were not pointing at the right thing, to the point where my dad was saying, stop production. Stop the book. If you don't want to move the arrows, we're done. Just throw the book away. So it was a fight every step of the way, and taking pictures. One of the big things was back in the 80s, it's not like they had digital cameras.
Yeah.
So taking pictures and having prints done, you have to take a picture of an x-ray. And trust me, I've taken a lot of pictures of x-rays during my residency. It's not easy. And you get flashbacks, and he had to take a couple pictures of every x-ray in order to get one that he hoped was right. And there's thousands of x-ray pictures in this book. So the labor that he put into this book to make it right is so huge, and people don't understand that. They just see the book and they think, oh yeah, he wrote it. But they don't understand that the first one took 6 years and each other one took 3. So that's 12 years of his life that he gave to this profession. And I really think that it's important that chiropractors understand what it took for him to do that, and the dedication to our profession that it took for him to do that. So that's what this book is all about. And throw it in with some baseball stuff, which kind of taught him the direction and taught him the focus of how to accomplish something and do things as a team and to succeed as a person. So I think that it's a nice twist on his life and how he's accomplished things.
I will ask you one final thing.
Okay.
Do you think he should have been left-handed?
I mean, I don't think so. He was a great baseball player, obviously, but if he was left-handed, we wouldn't have what we have.
I think you're right. Well, very good. You did good.
Thank you.